What do you do when you have a vulnerable population of patients with cancer, and a new strain of virus hits as a global pandemic within few weeks? We know that the new COVID-19 strain of virus within 6 months caused 70 lakhs infection, and to date we know that more than 10 crore patients have confirmed COVID-19 infections, out of which 20 lakhs are lost. Cancer patients are prone to many challenges. They have increased susceptibility to the infection, and they have increased mortality rate. Several studies have shown that during such pandemic, their care is interrupted and the outcome is poor because of the delay in diagnosis and delay in treatment. Several hospitals, both in the western and eastern parts of the globe, have modified their care policies to take care of these cancer patients, particularly during this COVID-19 pandemic. Apollo Cancer Center, Tenampet, is a leading cancer hospital in the country. We cater to several national and international patients. We realized that our patients are fighting two wars, one with COVID and another with cancer. We did not want to let down our patient. We reaffirmed our commitment to our patients, and we revisited all our standard operating protocols. We wanted to increase the safeguard to our patients so that their care and treatment will continue uninterrupted. As early as April 2020, we introduced several safety measures. We started screening for anyone who enters the building. We introduced safe distancing in the floors, lifts and furnitures. We also augmented our COVID-19 testing protocols with a rapid turnaround, and we also made sure that all patients who were designated for procedures were rapidly screened and the results were available for a quick turnaround. A management committee was formed to put the safeguard and the safety measures. Patients were triaged based on the urgency of their cancer and urgency of the cancer care needed. Safe surgery, safe diagnosis, safe radiation, and safe chemotherapy procedures were put into practice. Once the lockdown was relaxed, the patient flow increased, and once the transport improved and flights started operating, patients from neighboring states had also started to flow in. Apollo Cancer Center worked hard to cope up with this increased flow of patients. We decided not to let down our patient, and we did not want to stop. We did not shut down even for a single day. Bravery and sheer determination was our only strength. We continued our fight. Inpatient wards were re-engineered, ICUs were modified, emergency rooms were re-engineered to isolate the patients, and physical barriers were established. Over the past 9 months, from April 2020 to December 2020, Apollo Cancer Center has completed 60,000 OPDs, 8,000 admissions, 17,000 radiotherapy procedures, 70 cyberknife procedures, 1,500 surgeries, 50 bone marrow transplant, 15,000 chemotherapy sittings, and 3,000 PET scans. Care was delivered with the highest standards amidst all constraints. Today, we are seeing the light at the end of the tunnel. An end to the pandemic is now more realistic than before. Apollo Hospitals has also joined the vaccination program and has offered vaccinations for all its health workers. After a brave fight and several injuries, our smile is back. We are now more sure that we can win the war against two enemies, cancer and the COVID. And more importantly, we will make sure our patients will win.